I'm addressing you as ladies and gentlemen because there are no more children. And grown up, another less than a year, you will be called doctors. Yes, sir, doctors. The huge transformation, huge progress. And that's an achievement not for you, for your parents. They have sent you here to be called the parents of doctors. That's their first priority. I used to think, when I had joined BBS more than 50 years back, I used to think this, craze for BBS thing will vanish. It did vanish in between. Now it's come back again. People are very, very crazy to be called a doctor in white coats. Wearing a white coat is a very significant thing. And see, it's not the wearing of white coats. It should be, respected wearing a white coats. If you're not working as a professional, interested in other things. See, interest in other things is equally important. I keep insisting. The sports, cultural activities are part of education. But they are all secondary. Primary is always your academics. Dr. Anji Reddy sir also has been telling all the time. In fact, he himself has selected me as the president of CAP. You have seen it. Committee for Academic Progress, as the president. And it's been selected by him. Earlier it used to be on election. During this time also they wanted to do election, but he said no. I'll select somebody. He will be the president of CAN. So now you know who I am, what I am. I'm Colonel Pradeep Pendyala, who has worked in army for more than 33 years. After that also, for 10 years I've been working in civil hospitals. More than 5 years at Hyderabad, Medicity Hyderabad. Hope you have heard of Medicity Hyderabad. And for the more than 5.5 years I'm working here. ASRAM Medical College. Of all the colleges, ASRAM is the best. There's no second thoughts about it. And congratulations to all of you. Let's round of applause for ASRAM. You should be proud to be doctors. You should be proud to be products of ASRAM Medical College. Today I am going to tell you something very, very interesting, that is indications and principles of regional anesthesia. Now, what is this regional anesthesia? If you know this, almost half of important part of anesthesia is over, because the other half is general anesthesia. There's somebody sleeping. Are you alright? I have given anesthesia already or what? Okay, the best part of regional anesthesia. She's sleeping means anesthetic effects. That is, I'm successful in giving anesthesia. So well, fine. Well, the difference between general anesthesia and regional anesthesia. In regional anesthesia, you are conscious and awake. In regional anesthesia, you are conscious and awake very much. You can see the surgery yourself. You can talk to, sir, ikkada katchi and ikkada problem. Only that you should be bold enough to see surgery being done and blood being, spurting out when the surgery blade is put. You should be bold enough. So I keep most of the people engaged, talking, when they are under spinal anesthesia, the video. I make sure that I'm a good talker, you know it better than me. So I keep talking throughout the surgery. So they are preoccupied. And they don't know what is happening. So because they are conscious. It's like, very eerie feeling when you know that somebody is cutting your leg or putting a big incision with a scalpel, and you are conscious. That's a very difficult thing. Unless you are very bold, very difficult. Some people insist that we want only general anesthesia. I want general anesthesia. I keep telling them also, regional is much, much better, superior to general anesthesia is better. So many complications can be avoided, pulmonary complication, and thrombosis, other problems, blood loss, so many things can be avoided by giving regional anesthesia. They insist, no, main tactical and general anesthesia, micro-incision, so that's strange. Go for always regional anesthesia because you are conscious and the recovery time is very, very fast. On the same day, you can start eating also. And as I just mentioned, you can be talking. And just imagine a person getting regional anesthesia for cesarean, LSCS. Cesarean, the baby is born. If you are given general anesthesia, once you come out of anesthesia also, much later you will be conscious but enough to understand what is happening around. Then the baby will give it to you for suckling or anything. It's too late. But here in regional anesthesia, spinal line and cesarean, the moment the baby first cry, you are hearing. And I make sure that I take the baby and put the baby next to the mother and the mother kisses the child first. Can you imagine that kind of feeling? It's worth millions of dollars. You know, the first baby cry, the mother is watching it herself and she's participating in the boys are busy, I don't know, some people are doing some WhatsApping. Don't do that, please, hello. Don't do that. Please listen to what I'm speaking. In just a computer, in just a laptop. I'm here. I'm better than a computer, I'm faster than a computer. Faster. Put any question I can answer before the computer answers. That's the ability I have. Faster. If you have doubts, ask any question I can speak in seconds. Microseconds. Secondly, coming back to our topic, regional anesthesia. So, in just not we give the local anesthetic so that part of the body is numb. Now, how the hell it becomes numb? Some magic or black magic? No. Suppose we have given local anesthetic. What will happen? There are two channels, sodium channel for action potential, for the nerve impulse to pass, and now the pain has to. Somebody is cutting here, there will be pain. That pain, you will know not because of this signal, the afferent nerve, the brain. And brain tells you it's the pain. That's how you react, isn't it? Now, we are cutting off that signal to the brain by giving local anesthesia. It's not a permanent, it's a temporary measure. Where the sodium channels are blocked. So, the action potential and the nerve propagation of the signal is blocked temporarily. That is how the local anesthetics works. Okay. Now, what is it allowed? Regional anesthesia can be three, either spinal, epidural, or caudal treatment. Regional epidural, it is not piercing the dura. Epi, and above. Dura, mater. Dura matter, matter, mater. Paya matter. Adhikar. Actually, it's a Latin word, it's a pia mater. But I'm not asking you to start speaking Latin. It's a pia mater. In the mater, single T. But there is grey matter. Akkad double T. Akkad matter. White matter, grey matter. Which you have in plenty. Grey matter. Unless you have got plenty, you would not have become. You have not come to this stage. Being a doctor, becoming a doctor, isn't it? You are one of the top. And this girl is one of the top. Excellent speaker also. Last time you spoke, na? Excellent. You gave a fresh round of applause. Amazing speaker. Amazing speaker. Amazing. That's the kind of speaking ability. But just now, the girl was talking along with Loknath sir also was equally good. Who was the girl? Raise her hand. She's not here. Disappeared. Who is the girl who was speaking along with sir? Is gone. And then, okay, the time reaction. Fast. Madam, fast. You should be fast. Slow, madam. Slow, reaction. Nagistunde. Assalim. Even if you get 100% mark, I'll fail you. If your reaction time is slow. What's sir? Alage vastune undu. Vastune. Why? Personality matters. How you respond to question, how you behave in the society, how you converse, how you talk. Some of you are excellent, very, very good looking. God has given you good looks. Fine. In fact, Ashram is famous for good looks. Famous. I don't అందరూ మంచి గుడ్ లుకింగ్ వాళ్ళందరూ ఆశ్రమం లైన్ కట్టుకొని దూరిపోతారు. ఎందుకో తెలియదు. But the problem is that unless you have a personality, your looks doesn't matter to me. Zero. I'll give you zero for your good looks. Why? Unless you should be able to stand in front of the crowd and talk confidently and express your thoughts. You're Mr. Zero. Unless you speak confidently and know your academics, you're Miss or Mr. Zero. Good looks hardly matters. Boys especially, you should remember that. Your height, Ajana Bahalu, 6 feet 2 inches. Question not this. Answer change confident and nilbody. Body language matters. Why I am telling you this is all part of education. I insist. Body language is very important when you are answering a question in a society. How you are walking, how you are talking, how you are behaving in the society, how you are talking to the patient, how you are talking to your parents, how you are talking to your siblings. All matters. When you go back tomorrow to your hometown, parents should ask you, నీలో మార్పు కనబడుతుంది అంటే మీరు చెప్పాలి. అక్కడ డాక్టర్ ప్రదీప్ గారు అన్నారు, ఆయన నేర్పించారు మాకు, అందుకు మార్పు వచ్చింది. మొన్ననే వరల్డ్ డాక్టర్ డే సెలబ్రేట్ చేశారు. అవునా? తెలుస్తుంది, టీవీని తెలుస్తుంది, వాట్సాప్లు చేస్తే అంటే తెలుసు కదా, అందరికీ తెలుసు. మొన్ననే వాట్సాప్ లో మెసేజ్ వచ్చింది, వరల్డ్ లాఫ్టర్ డే. ఇట్స్ వెరీ ఎసెన్షియల్. నవ్వడం చాలా ఎసెన్షియల్. అందరూ ఎలా మొహపడతారు తెలుసు. అరే ఇలాంటి వాళ్ళు గొప్పగాళ్ళు అసలు అసహ్యం. వాళ్ళు చూస్తే 85%, చూస్తే 85 వచ్చింది సార్. 85 నీకా? ఎవరిచ్చారు? వాడిని చూపించరా, వాడిని చూపించి ఎవర్రా నీకు 85%? ఆయన అలాగ అడుగుతాను, 100% అలాగ అడుగుతాను. 85% వాడు ఇచ్చిన వాడితో క్వశ్చన్ అడుగుతాను, ఎందుకు సార్ ఇలాగ ఇచ్చారు 85%? Does he deserve? No. It's a part of thing. All these things are part of education. How you speak. Against the against. Pressure ne blood pressure ne blood pressure. Pressure ఏంటి కదా? Pressure, sharp. Sharp ne sharp. Leisure అంటారా? Britishers leisure అంటారు, Americans leisure అంటారు. అది షా. ఆ షాని ఇక్కడ ఉపయోగిస్తారు. ప్రెషర్. ఇది షా. షా, ఆశ, ప్రెషర్. తప్పు చేయకండి. ఎందుకు చెప్తున్నారంటే లైఫ్ లాంగ్ మీరు గుర్తుండాలి. నేను చెప్పిన మాటలు మీరు రేపు పాస్ అయిపోయి ఇంకా గ్రాడ్యుయేషన్ సెరమనీ చేసి జింగ్ 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 అనుకుని వెళ్ళిపోతానే, మర్చిపోతారు. నేర్చుకోకుండా ఇంపార్టెంట్ లెసన్స్ ఆశ్రమంలో నేర్చుకోకుండా వెళ్ళిపోతారు. నేను పర్మిట్ చెయ్యను. I will not permit. I want you to be good doctors and successful doctors and popular doctors. Popular అంటే రియల్లీ పాపులర్. థర్డ్ అంటే జంప్ చేసి చచ్చిపోయి, లేకపోతే పాయిజనింగ్ తీసుకొని చచ్చిపోయి పాపులారిటీ రాడు. ఆ పాపులారిటీ కాదు, మంచి పని చేసి పాపులారిటీ చేయాలి. If you want, you're a man, popular, become popular by your deeds, by your work, not the words. Your work should explain your action, your personality, your words. Okay, coming. Sorry, the topic రావట్లేదు, అన్ని మాట్లాడుతున్నాను. Okay, this is a very interesting topic. As I just mentioned, regional anesthesia is a type of anesthesia that blocks pain in a specific area of body. It involves injecting anesthetic near nerves to numb only the part of the body that needs surgery or treatment without affecting consciousness. So consciousness is very much there. Where are the types and spinal anesthesia, epidural anesthesia, caudal anesthesia. Now, coming to this history, who has discovered this? Of all the people, most important person, Majjan unnadu, August, BIER, under Bayer's block అంటారు. Bayer కాదు, Beer. Boys bar తెలుస్తుంది. Beer. వాడు ఆ బియర్ సౌండ్ వస్తారు. Although it is spelling is BIER, it is pronounced as beer. Not well. ఆ అమ్మాయి పంట పడిపోతుంది, ఏంటి చాలా ఎఫెక్ట్ అయింది. అలా ఎందుకు పడిపోతుంది? Not well? Okay. Exception, fine. Okay. Now, not well, fine. No problem. So, beer, August beer. Why I have given this importance to this gentleman? ఇది జాగ్రత్తగా వినండి, చాలా చాలా ఇంట్రెస్టింగ్. నేను క్యాంప్ లో కూడా ఆయన గురించి మాట్లాడాను, సైంటిస్ట్ ఆఫ్ ద డే. Who is this August beer? August beer is the intravenous regional anesthesia father. He was the first person who did successfully regional anesthesia. Yeah. Just IV లో local anesthetic పెట్టి డబుల్ కఫ్ పెట్టేసి ఈ ఏరియా అంతా నంబ్ అయిపోయి ఇక్కడ సర్జరీ చేయొచ్చు. షార్ట్ పీరియడ్, అరౌండ్ విదిన్ 1 hour if you do surgery, IV regional anesthesia is effective. He was the first person. ఇప్పుడు 1908 లోనే డిస్కవర్ చేశారు. ఇప్పుడు 2000. Almost 120 years back. Not only that, he is the first person who has done successful spinal anesthesia. ఇది జాగ్రత్తగా చాలా చాలా ఇంట్రెస్టింగ్. Way back on 16th October 1898, this actually has happened. How the spinal anesthesia was discovered. This is the most interesting. He wanted to give anesthesia on himself. It's a daring should cocaine. He told August August Beer. He has an assistant, and whom he said, give anesthesia on me. Hildenbrand. What is Hildenbrand? What is August? These are all American surgeons. Not American, German surgeons. Hildenbrand said, you yourself give me cocaine in my thecal space. How it happened? He gave successfully his assistant on his spine. Unfortunately, when the piston has to be attached for giving, cocaine into the CSF, that time that piston was not attaching properly to the needle. The whole CSF started leaking. The effect will not be good. Along with that, cocaine which was injected also was leaked out. So the effect of spinal was not good. So he was very disappointed. See, I have done so much. I have done it on myself, and because of his assistant stupidity, Hildenbrand's stupidity, the effort was gone. Look how the scientists think, at what level. At what you don't know how the drug will act. And you are injecting that drug into your spinal cord yourself for the first time. That too almost 120 years back. 130 years back rather. 1898. Ekkada 1898, ekkada 2025. This was his mind. Em chesatesna evening he said that no, I will give myself this spinal to Hildenbrand. వాడు ఎక్స్పెరిమెంట్ చేస్తాడు, నీ మీద చేస్తాను. వాడు అగ్రీ అవ్వడు. He gave it successfully. This time cocaine was nicely given successfully in the interthecal space properly. Appudu how the spinal is affected. Chudu how it was affected, how he checked. First he checked pain on the leg. Very impressed. He brought a hammer. He hit it on the femur. No pain. He was amazed. What is this magic? He's conscious. Patient is conscious that he's watching on the femur. Can you imagine what he did? Put a big nail into the femur. No pain. It's very hard. Nanda em chestadesna a pubic hairs ne avals chesaru. No pain. It's very very painful thing. Then he took the testicles and squeezed. No pain. Look at the level of experiment they are doing it. Highly painful thing. And they are doing it. Then they have displayed the discovery of spinal disease. The same evening, they had cigar and wine. This is how they celebrate. How? A fresh round of applause for August. Dear. This is the mentality of a person who discovers something. And I'm sure, 100% sure, at least one guy among you, one guy will become a scientist. Mark my words. That person should have this kind of mentality, this kind of proactive aggressive. That kind of, see at what level they sacrifice their life, they'll sacrifice anything and everything just to get an answer to the discovery. That is life. That is life. So this man also, James Leonard Corning, also in 1885 itself gives final, but it was not successful in the case now because too much of cocaine was given. Finally, very little amount of given. So, why so much of cocaine was given firstly, and why the effect was happened very late? That means very obviously it was not spinal. Spinal effect comes immediately within few minutes. 3 to 5 minutes spinal effect comes. Epidural takes 20 minutes to act. So he must have given epidural. That's what happened. Now this Fidel Page, he was given the credit of epidural first. That is 1921. Actually, 1901 importance started. Caudal anesthesia was successfully given. In the 1901, Kathleen and Sickard, they were French physicians. They started giving caudal. Caudal is nothing but a form of epidural. Okay. They successfully in 1901. Now, why this man is given credit of epidural in 1921? Because nobody was deitive enough to follow it. Nobody was following. Spinal is good enough, why do you want to do epidural? Epidural takes longer time and it is not directly connected to the spinal cord, it is above the spinal cord. So all these things, they were skeptical. People were skeptical using epidural. He brought forward Fidel Page, started performing regularly, he started telling the importance of epidural successfully. This is how he became the person who is directly credited to the discovery of epidural. Now you know the important thing. Coming to next. What is this spinal anesthesia? Spinal anesthesia obtained by blocking the spinal nerves in subarachnoid, that is intrathecal space. Anesthetic agents are deposited in subarachnoid space and they act on spinal nerve roots as well as dorsal root ganglia. I know in anatomy you must have been told what are those spinal nerve roots, right? Dorsal root ganglia, I'm sure you know. Spinal anesthesia is also called a spinal block or intrathecal block or subarachnoid block. Produces sympathetic block, sensory analgesia, also motor block. The difference between this and epidural, akkada motor block chala thikku untadi. Indulo epidural. Spinal thick block untadi. All other and motor block aitadi. Motor block untadi pain untadi. Pin prick, touch, sensation. Em untadi. Cold, temperature, em teliyadu. Joint difference, em teliyadu. So that is the difference. But sensory block, that is what is required. In fact, I prefer a patient to have sensory block rather than epidural block. So my patients, I have given some epidural blocks. When after surgery they are nicely walking back to their body. After surgery. Why? The sensory block is there. And the pain lay there. But motor is well effective. They can walk. See how good it is. See, that is the difference in epidural. If you master the technique of epidural, you're the boss. You get the best of best results. That is the okay. Now, spinal cord. So, what are these meninges? This is dura mater, outermost fibrous layer, arachnoid mater, middle non-vascular layer, and it catches on my pia mater. innermost highly vascular ends that ends at the phylum terminae. The extension of the diameter is known as phylum terminae. చూస్తున్నారా ఇది phylum terminae. ఇక్కడ middle portion చూస్తున్నారా, that is it. Spinal layers ఇప్పుడే నేను చెప్పాను. Once you start piercing the thing, ఇది ఎప్పుడు I always remember my own anatomy exams. Anatomy exams నాకు సంజీవ్ రావు గారు ఉండేది. He was the head of the department. He asked me a question till date I get nightmare. The question was, what is the space which is between two vertebrae? So then intervertebral disc. అది చూపించారు ఇంటర్వెట్రల్ డిస్క్. చూడండి, చాలా ఇంట్రెస్టింగ్ క్వశ్చన్ విచ్ ఐ కుడెంట్ ఆన్సర్. ఇప్పటివరకు నాకు రాత్రి కళ్ళు వస్తుంది, నేను ఐఎమ్ నాట్ ఏబుల్ టు ఆన్సర్, విల్ ఐ బి ఫెయిల్, బట్ ఐ వాస్ పాస్ సెపరేట్లీ. బట్ ద క్వశ్చన్ వాస్, see there is a small area in the disc which is soft. What is that? Nucleus pulposus, which I couldn't answer. He asked, what is that soft area in the disc? Nucleus pulposus. That is it. You have to pay attention to the minute things. Then only you will get the answer. Okay. When you are doing spinal anesthesia, the needle may choose a operation theatre. Needle puts. So the needle passes through certain things. One is obviously skin, then subcutaneous tissue, then supraspinal ligament, then interspinal ligament. దాని తర్వాత ఏంటి, ligamentum flavum, flavum కూడా అంటారు, flavum కదా, flame. Many anesthesiologists ఏం క్లియర్ చేస్తాం, ligamentum flavum, flavum కర్తలి, flame. Second question, what do you mean by flavum? The meaning is yellow. It's colored yellow, అందుకే దాని పేరు flavum. దాని తర్వాత క్లియర్ చేస్తుంది ఏమి కాదు, once you are, that is in the epidural space, suddenly give feeling. That is the place, epidural space, where you can inject the drug. If you go still ahead, you pierce the dura and you reach subepidural space. That is subepidural. అక్కడే cerebrospinal fluid అక్కడ మనం ఇంజెక్షన్ కొంచెం ఇస్తే చాలు, whole area is now. That will last for 2 to 3 hours. Adjuvants కూడా యాడ్ చేస్తే ఇంకా 3 to 4 hours కూడా అదే పని చేస్తారు. నేను చెప్తాను what are the adjuvants, why do they give. So this is what you have. This is in this slide. Now, the spinal cord normally extends from the foramen magnum to the level of lower border of L1 in adults, in children L3. L అంటే lumbar vertebra. Lumbar vertebra 1 వరకు ఉంటుంది adults లో, ఇక్కడ వరకు spinal cord. కిందకి వెళ్ళాలంటే L3 వరకు children లో. So you have to be very careful. అక్కడ ఇంజెక్షన్ వచ్చేస్తుందంటే స్పైనల్ కార్డ్ డ్యామేజ్. అది ఎందుకు చేస్తామో కూడా చెప్తాం, ఎందుకు, why it is so problem. ఇక్కడ చాలా ఇంట్రెస్టింగ్, ఇది మాకు ఎంబీబీఎస్ లో క్వశ్చన్ కూడా వచ్చారు. ఇది vertebral column consists of 33 vertebra and ఇక్కడ 31 pairs of spinal nerves. Who will answer this question? Why 33 vertebra are there? అన్ని vertebra ఒక స్పైనల్ నర్వ్ వస్తారు కదా, but why is there only 30? Very interesting ఏంటంటే 7 ఉంటారు, C1, C7, but nerve center అంటే C8. సో nerves 33 బదులు 34 ఉండాలి, ఇంకా ఎక్కువ ఉండాలి కదా, 31 కాదు, 31 బదులు 32 ఉండాలి, 32 pairs of nerves ఉంటాయి, 31 అక్కడ. కానీ కాక్సిక్స్, when you see కాక్సిక్స్ పైన ఏంటుంటుంది, sacrum fused to it. That అక్కడ తక్కువ nerves. So that's why the number of nerves are less than the number of vertebrae. That's how it works. Okay. Now, ఈ ముందు ఒకటి ఇక్కడ, this is very interesting. Have you heard of this? How do you pronounce this? This is Robin's space. You must have heard of this. This is cerebral space. When are coming out, there is a space around it. That is known as. How do you pronounce it? Can anybody pronounce it? Virchow. Me try saying, madam. Let me see. Pronounce that word. It's Virka. Then Virshaw. Virka. Kavu, holy. Pardon me, why this color, deep? Kavu, holy kavu. అలా గుర్తించుకో. That is Virka, not Virshaw. Okay? Why so